So let's take a look at the spinal cord and cross section. So first, we're going to look at the meningeal layers that surround it. And before I really get into that, let's just take a second and look at the vertebrae here. So this is the body of the vertebrae. This is the spinous process. Remember, in anatomical position, the body always faces anteriorly and the spinous processes always face posteriorly. So you can use that to your advantage when you're naming some of these structures in a minute. So just like the brain, the spinal cord has three distinctive meningeal layers that surround it. The outermost layer is known as the dura mater. Dura mater means strong mother. The middle layer is known as the arachnoid mater, and the innermost layer is known as the pia mater. Now in the spinal cord, you can easily see some spaces in between. Here, outside of the dura mater, we call this the epidural space, and it's full of blood vessels, which is what these little blue-purple things are here, and fat, which acts as a little protective cushion for our spinal cord as it sits in the vertebral foramen. You also have a subdural space, which in a typical healthy individual should not have anything in it. It should be relatively empty and thin. You should have a big gap, though, between the arachnoid mater and the pia mater that's touching the spinal cord. This space, just like in the brain, is called the subarachnoid space, and this is where our CSF is flowing. So CSF is in the subarachnoid space. Now, if we look at the spinal cord, we can see that it is divided into gray and white matter just like the brain, except it is organized in the opposite fashion, with gray matter on the inside and white matter on the outside. So if you notice, there are distinctive sections of both gray and white matter, and so we name them based on their shape and on their anatomical location. So the white matter we organize into columns. So we have the posterior or dorsal white column. Some older textbooks call this the dorsal or posterior funiculus. You don't have to use that term unless you just want to. Then you have lateral white column, anterior white column. And again, this is bilateral, so it's the same thing on both sides. The gray matter is organized into horns, so you have the anterior horn, lateral horn, and posterior horns. The gray matter is connected along the midline of the spinal cord in a little area called the gray commissure. And then you have the central canal in between, which allows the CSF to flow down the length of the spinal cord. And this is ultimately connected with the ventricles of the brain, specifically number 4. Also, if you notice on the surface of the spinal cord, there are distinctive little indentions. The one on the anterior side is much deeper than the one on the posterior side. So separating it into left and right halves anteriorly, you have the anterior median fissure. It's a fissure because it's deeper. And the posterior median sulcus on the posterior side. Additionally, on this model, you can see how spinal nerves begin. So coming off the posterior or dorsal side of the spinal cord, you have your posterior or dorsal roots and your anterior or dorsal roots on the front side. So here's anterior root, posterior root. And again, you can call these ventral or dorsal if you prefer, because some textbooks do. So the posterior or dorsal root contains only sensory information. The anterior or ventral root contains motor information. The dorsal or posterior root also has a ganglion, so basically this is a point of synapse. This is where the cell bodies are found, called the posterior or dorsal root ganglion. And this happens before the spinal nerve itself actually forms. So the posterior root, which is sensory, and the anterior root, which is motor, merge together in a really short little fashion to form a spinal nerve. And that exits the intervertebral foramina, so the holes in between adjacent vertebrae. And it's very short. Pretty much as soon as it forms, it branches again into our posterior or dorsal primary rami and our anterior or ventral primary rami. Now the ventral rami supply most of the peripheral nerves in our body. Dorsal primary rami predominantly go into muscles of the deep back.